Hello, dear viewer of U24. You're most welcome on the State of Affairs. Ampaire Amon Buteega is my name. And tonight we're going to be looking into something that is very important, that you need to come so close to TV as we all learn. I've come here to learn, and I'm glad that I've been joined by a very special team of guests that are going to be taking us through this evening, learning and also inspiring the people of Uganda. With me in the studios of U24 today, I do have a big privilege and honor to have the experts, consultants, and senior surgeons in the country we call home, in the country we call Uganda. This is Dr. Ampaire Nodri.
So
she's the consultant cardiologist, head of cardiac anesthesias. You will pardon me, and I'm glad that they're going to be correcting me on how to pronounce those technical words. Most welcome, Nodri, Dr. Nodri.
Thank you very much. Thank you for having me, Amon.
Interesting. This is the next to Dr. Nodri is Dr. Muhoozi Rwakariebe, is the consultant, also pediatric cardiac surgeon, joining us on the State of Affairs tonight. Most welcome, Dr. Muhoozi.
Thank you, Amon, and good evening, viewers.
Interesting tonight, as you heard, we have a team of senior surgeons, consultants, and doctors, the best that you can say we have in the country. And tonight, when you have the experts of this kind, you know that we are prepared to learn. Join me on this journey of learning, and we would love to understand how serious is the heart problems, the heart issues, heart diseases in the country, and as the experts that we rely on as the country Uganda, how are they managing this problem? Do we need to join them in prayers, or they are managing the situation? Dr. Nodri, you happen to be heading that very sensitive department. If you can help us take us through what the institute is about, how is your mandate, and then we zero it down to your department that you head.
Yes. Thank you very much, Amon. So, as Amon has aptly said, we are from the Uganda Heart Institute, which is the only center in Uganda that is providing super specialized cardiac services in the country. Our mandate to Ugandans as an institute is the provision of these services, and this is all the way from prevention to diagnosis and then management. We have various arms at the Uganda Heart Institute, and these include the medical arm, we have a surgical arm, and we have a research arm. So today we are here to talk about cardiac surgeries in Uganda, and I'll just say, so our focus is mainly going to be on the surgical side of the Uganda Heart Institute. So for the surgeries, we have both adult and pediatric, so that's adult and children that we work on at the Uganda Heart Institute. And to make this possible, we have various experts that do this. So we have cardiologists that receive and diagnose and manage the patients as they come in. Then we have the skilled cardiac surgeons like Dr. Muhoozi here today, who participate in the actual operations, and we operate those for children. We operate those with holes in the heart, those who have abnormal blood vessels, we operate them as well. And for adults, in case they have heart valves that are not working so well, we operate on them as well. So to support all of this, we have the cardiac anesthesiology department, which is the one that I head, that Amon has said. So the cardiac anesthesiology is a specialty that involves what we call, medically, we would say perioperative management of patients. But that means that we look after patients from before they have their surgeries. We're the ones that look after them in theater, keep them comfortable, keep them pain-free, and make sure that they're asleep enough and in a state that the surgeons are able to work. After that, we are the same team that looks after the patient in the intensive care unit or the ICU, from when they come out of surgery until they're well enough to be transferred back to the cardiology team, who are the doctors that will look after them up till the point that they get home.
Interesting. Thank you, Dr. Nodri. I'm starting to learn before even we take off. I come to you, Dr. Mohozi. She mentioned about the children also who are undergoing surgery and those heart-related issues. How do you manage children? At what age do you say this child needs surgery? Because I want to believe that children are far different from adults. Because adults can say, I feel pain within my chest, maybe I need to go do checkups. But one wonders, how do you deal with children and at what age?
Thank you, Amon. Cardiac surgery for children is basically for defects which children are born with, the ones we call congenital heart defects, or defects which occur in the creation or formation of the heart. And you find that there has been a malformation which causes a hole to appear within the heart, or vessels which come out of the heart to come out wrongly, or defects which persist after the child has been born that are supposed to cross naturally and they don't cross. Now, the timing for surgery depends on the diagnosis. Our practice is evolving, and world over, you have the diagnosis of some of these defects which are captured when the baby is still in the mother's womb. And once they are diagnosed and discovered, a plan is put in place to ensure that once this child is born, they can have the life-saving surgery at the right time. And then there are those who we discover the defects after they have been born. Strangely, our system, however much it's growing and it's improving, some of these patients do present or reach us late. That is after they have been born, and once the mothers have detected that this child, for instance, is not growing well, or my baby is not breathing well, and they notice that there is something different from the other normal babies, and they bring them for evaluation. Now, once we discover that the child has got a certain type of cardiac lesion or defect, we plan adequately, and it depends on a number of factors. Uganda, we're a population of 50 million citizens, and we, as Dr. Nodrin has mentioned, heart surgery in Uganda is possible only at the Uganda Heart Institute. So this means that the patient who is born in Ajumani with a heart defect, or one who is born in Kisoro, or one from Soroti, they all have got to have their surgeries or interventions at the Uganda Heart Institute. So this kind of delays the process, and you find that there are those who reach us in time and we are able to have solutions for them, and then there are those who are discovered late that at times we have to first stabilize them, which comes into the question of the timing for surgery. So the timing for surgery, once you discover a child have a heart defect, there should be a plan to see that that defect is corrected. The longer it takes to have a solution, it is damaging the systems of the baby. For instance, it can damage the respiratory system, the lungs, and you find that in that way, once you carry out the surgery for the patient, for the infant, probably they will not recover well, or they will take time to recover, or worse, they will recover with some complications, which might even include losing the baby. So the earlier, the better. And we hope as the Institute grows and our practice improves, we shall be able to provide these solutions in a timely manner, that once a defect is discovered, a solution is availed, and furthermore, that even we reach a stage where we can discover the defects before the baby is born, so that a plan is put in place that once this child is born, already there is a plan in motion to make sure that surgery is carried out or an intervention is carried out.
Interesting. I come back to you, Dr. Nodrin.
Yes.
How do you prepare a patient for surgery? When you're starting your submissions, you said that your department is as well responsible for preparing someone for that serious function or exercise, I would call it.
Yes.
But how do you ensure that they are well prepared?
Okay.
Especially mentally, because I had surgery sometime back in 2018, but the doctor disclosed that information that you need to do appendectomy, you call it?
Yes.
I lost some
Can imagine.
some senses, I would say. So how do you prepare them?
Yes.
To make sure that by the time they go into it, the theater,
Yes.
they are mentally, physically, emotionally prepared?
Thank you very much for that question. And I like that you started by sharing the mental toll that the knowledge of having a surgery took on you, because it does take a mental toll. And, you know, when you are grown up, yes, you think about it, and it's a difficult thing to have to deal with. But we, as Dr. Muhoozi said, we work on children, really little children, all the way up to grown-ups. And even for a grown-up, any surgery is scary, but a heart surgery is very, very, very scary. And for that reason, we go out of our way to ensure that the patient is fine.
What makes it scary? Is it because it is one of the most important and functional body parts that we have in the body?
Absolutely.
In our systems?
Yes. So your heart pumps blood to all your organs in the body, and this blood that is pumped is carrying oxygen for your tissues, which is what your tissues need to survive and do the work they're supposed to do. This blood is carrying glucose, which is the energy source for the rest of the body, and a couple of other things. So without the heart beating, there is no life, literally. Okay, so and I think because of that knowledge, knowing that you're going to be put to sleep and we're going to have to open up your heart, it is quite daunting. So because of how important this is, I would like to start by saying that much as the cardiac anesthesiologist will take the lead in the immediate pre-operative period or immediately before surgery, patient preparation is taken very seriously, and we are a team that does this. So we work together with the cardiology team who have seen a patient from way before, from when the time they got to know that they had a heart problem, and we work together with them to make sure have they been on their drugs, is the heart beating well enough to handle itself after surgery, because operating on it weakens it. So we have to make sure that it's in a state where it's strong enough to be able to deal with the stress of the period right after it's been operated. So the patient preparation in that case involves the medical aspect, which is where we, of course, we repeat all the tests that the patient has been on. We have to scan the heart again, make sure that we do new x-rays for a patient. We'll also make sure that we have new blood tests taken. A patient cannot come into theater if they have an infection of any sort, okay? And then we make sure that we've also ensured that we know how the heart rhythm is beating. So is the heart beating normally or in a way that is acceptable, okay? So we have the medical aspect, and as I've said, we do all these tests again immediately before surgery, because our goal is a successful surgery. We want a healthy patient who is going back home to serve their families and serve our nation, right? So as you started by saying, there is a mental toll to surgery. So it's very important for us to talk to these patients. So for, let's say, if it's a really little child that does not understand, then we talk to the parents and we let them know what the surgery is going to involve. But not only that, but we start telling them from the morning of surgery or even the day before surgery. So this is when you're going to stop eating, and this is why you need to stop eating at this time. But you can take this and that. These are the medications that you need to take. And for these ones, don't take them because they will affect the surgery in a particular way. And then we'll also tell them it's okay to sleep and things like that. We'll advise them what time to wake up, what time to have breakfast or not, how to take a shower, how to brush teeth, all those basic things. And then we'll walk them through the time the nurse will come to prepare them, what they will be made to wear, show them where the theater is, how we'll take them there. And then we also tell them about the number of people that are going to be in the theater, because sometimes it's scary. You've only talked to Dr. Muhoozi and maybe Dr. Nodrin before surgery, and you enter the room and you find 10 people. But all these people have a role to play to ensure you come out well. Yes. So we take them through all of that, and also what to expect. Where will your cannula be placed? What medication will you be given, and at what point? How will it make you feel? And then after you go to sleep, when you wake up, this is what you're going to find here.
How do you deliver that all information? Because I also had someone who said that the way they talk to you, sometimes it is a lot of information, and to absorb it itself is scary. Yes. How do you package it? So
I recognize that. that it can be overwhelming, okay?
Yes, because your candidate is going to be here, you are going to meet 10 people in this in the theater.
Yes.
and you're trying to absorb all that information into your head.
Okay, so I think we would not be as mechanical as Amon has been, but I would firstly, by the time a patient makes it to a theater list, for a patient whose surgery has been planned, they have had multiple conversations at multiple levels before this actual moment. So when we get to the day prior to surgery or a few days prior to the surgery, we are adding on to that. Of course, the stakes are higher at that point, but we, depending on the age group, the level of understanding, we also break it down. We have patients who do not speak English. I will not come and speak to them in English. If it's a language I cannot speak, then we'll get someone to translate for them. If it's a little child, because we have an age group of maybe 4, 5, 6, they understand. So for those ones, they've, much as they have, by virtue of the fact that they've had heart disease, they've been in hospital multiple times, so they know a cannula. So we'll talk through that as well. If we need to play a video for them and show them pictures, sometimes walk with them to where the theater is, we'll do that, yes, because they need to know. Yes, and if sometimes we'll also take them to the ICU. Exactly, and then they know what to expect. So we try to break it down, because at the end of the day, it's important to us that our patients understand. So again, the psychological arm is very, very, very important, because it plays a critical role in patient recovery.
Interesting.
Yeah.
Dr. Mhozi, when we talk about heart issues, heart diseases in this country, how serious is the problem?
Now, as I started by telling you that Uganda, the population were in the last census approximately 50 million citizens. Globally, the incidence of heart disease, as in children, congenital heart defects, you look at 3 to 5 out of 1,000 live births. Now, to our population in Uganda, that translates to 1% of the children who are born annually. In Uganda, by estimates, annually you have 1.6 million babies who are born. So 1% of the 1.6 babies born present with a heart defect. Now, the good thing on this is that not all of the 1%, which translates to 16,000 babies, not all of them will require surgery or interventions. A fraction of those will need to visit a hospital to get diagnosed, to get treatment, or later on determine if they need to be operated on or to have an intervention. Surprising, a large section of the population you find that have got some small defects which we are able to live with, which are not detrimental to the health of the individual. But then you'll find that close to 800, they require to see a heart doctor in their lifetime. And of those, there are those that are severe enough that the child might not survive after birth through the first month of life. There are those which can allow the child to survive, grow to 1 year, but at the expense of poor health, not doing well, not breathing well. And these are children that you will often find that they have to visit a hospital every now and then. They have recurrent lung infections. At the beginning, I mentioned that heart defects at times they affect the other systems, and commonly the system that is affected is the respiratory one, the lungs. So you find that a lot of the debilitating concerns and health challenges on the child's respiratory system. These are children whom you find are being treated of pneumonia, and among the things that the mother will tell you is that my child is not breathing well, or when my baby is suckling, breathing, they are like choking, they are not breathing normally like another patient or another baby they have had. So you find that the burden of disease is immense, and the solutions, however much are there, are still limited to those who are seen, those who are able to be screened, those who are able to see a heart doctor or a doctor who will identify that they have a defect which needs to be worked on or which needs to be treated. There are a lot of patients out there in the community, children, infants, who are presenting heart disease, who are not able to actually get a diagnosis. We are dwelling a lot on heart disease which children are born with, but that's not the only one. There is another form of heart disease which we term as acquired.
I was going to ask you, what are some of the common heart conditions that you encounter at the institute?
Now, we have mentioned the congenital heart defects, the defects which children are born with, but there are other heart diseases which we call acquired heart diseases that affect the heart valves.
Acquired?
Acquired, it means that the patient was born with a normal heart, contrary to the other one who is born with a defective heart, a heart with a defect. This one is born with a normal heart. Now, there is an infection, a strep infection, a throat infection, to put it in common man's language, that affect commonly young adults, young children. Now, the body is able to fight this by producing antibodies, the immune cells that fight off an infection. But once they produce to fight off that infection, they now turn against the body, and commonly they turn against the heart valves. Now, this eats away and destroys the valves, in that the valves which are within the heart chambers that control the amount of blood that is coming to the ventricle, or what the ventricle will pump into the body through the aorta. Now, once these valves are affected, consequently the heart starts not to perform well. It can dilate and end up going into heart failure. Now, that affects the child's well-being. There are children whom you will find that, for instance, the feet are swelling, the abdomen is swollen, they are not able to breathe well. So for those ones, we have solutions which are valve surgery, but again, they are a lot as per our population and the single center which exists to offer solutions to these patients.
Maybe if I can add to that, yes. I know Dr. Mhoz is a pediatric surgeon, so he'll dwell a lot on the children, yes, and which is great. But I think we also need to know that there's a number of adult patients that will develop heart disease. There's heart disease that will come as a result of some of conditions that are left untreated, like high blood pressure, if it's not controlled, which is why it's important, if someone has been diagnosed with high blood pressure, it's important that they're consistent with their medication and get regularly reviewed by their doctor or their cardiologist. And then there are conditions that come because this heart is beating every day from the time that you're born. So obviously by the time you're 70, it has been beating for 70 years, right? So non-stop. So as patients grow older, there are those conditions that will come as a result of old age. Some of the blood vessels will dilate, let me not use the word dilate, they will become loose sort of and swell up and lose their ability to use their sort of elasticity. So we have those conditions. So our patient population is very varied, all the way from newborns all the way to the really elderly. But these patients will have, some of them will have similar conditions, but then there are those that will be commoner in different patient populations.
If you can allow me to take you back step by step, I want someone who is watching this show to be able to learn, and we're here to teach our communities, especially on preventive measures. But you cannot prevent something that you don't know its cause. If you can help us to know, Dr. Mhoz talked about those which are acquired, that someone can be born with a functioning or a normal heart, and along the way you get a heart issue.
Yes.
So what are some of the causes? If you can talk about some, Dr. Nordrin and Mhoz will tell us how we can prevent. At least that would be good for our lesson today.
Yes.
Causes.
Okay, so many times when we say the causes of heart disease, it is hard to say that this is a particular thing that caused it. So instead we like to talk about risk factors, or there are certain things that make or increase the likelihood of the fact that you will end up with a heart problem, okay? And these things, we've been told about them over and over again, but we'll go through some of them again. So I will start by looking at there are certain conditions or diseases that are going to increase your likelihood of ending up with a heart condition. Uncontrolled high blood pressure, and I stress uncontrolled because there's a mentality that we have in, I don't know if it's just Uganda, but we like to say, I'm taking my herbs and they're going to control the blood pressure. Or the blood pressure will heal. I'm just stressed, it will get well. let me rest, it will get better. Yes, but it's very important. Exactly. Yes, but these uncontrolled high blood pressure, so you're not on medication that is helping to keep your blood pressure within the normal range, is going to increase the risk that you'll end up with a heart condition because your heart is having to work much more than it should be. Yes, then conditions like uncontrolled diabetes as well will put you at risk of a heart disease. There are other conditions that people may be born with, like connective tissue disease, that would also put you at risk. Then there are some that we don't know. There are some genetic conditions. Some people in particular families are more predisposed, for example, to abnormal heart rhythms and things like that. Then we have lifestyle choices. Smoking really puts you at risk of heart disease, especially what we call heart attacks or myocardial infarction. So it's we really discourage smoking and smoking nicotine. Prolonged use of alcohol will also distort your sugar control and your fat control in the body, and all these will predispose your heart and big blood vessels to disease. Okay, and then obesity, or yes, obesity is being overweight. So it's very important that we keep our weight in check, and we always encourage healthy eating as well as an active lifestyle. I think something that's also cropping up in the young people now is you know, there's, I think, a lot of reasons to be stressed now, and all of this is putting a lot of people at risk of high blood pressure, which still is going to put you at risk of heart disease. And then there are some things that are just carried in families, and we don't know why, but you'll end up with a heart problem, and it's no one's fault.
And it is in the genes?
It is in the genes, in the family.
Oh, so
Yes.
I can get heart issues or heart diseases from my grandfather or my father or my mother.
Yes, there could be. There's some genes or something that's passed on in the blood that we may not know, but you'll find that in certain families, more than one person has had a heart attack at a particular age. So that happens as well.
Oh dear viewer, it is high time that you know and start searching in your family. If there is anyone who has ever had any heart issue, it is very important that you start especially checkups and also try to make sure that you are safe. We are not saying that you are sick. I'm only saying that it is very important that we always check ourselves, especially when we think we are at risk of getting heart issues or related heart diseases. I come to you, Dr. Mhozi. How best can we prevent?
Now, prevention, as we commonly say that prevention is the best medicine to an existing disease. Now, back to defects which babies are born with. Dr. Nodrin has mentioned some of the causes and has highlighted that majority of these conditions you will not have a single cause and say that this is the cause explaining why someone has developed or has acquired heart disease. What we look at a number of risk factors, and risk factors, they have got to come in to play together, a number of them, for the disease to manifest. The reason why there are heart defects, we cannot confidently tell a patient 100% that you have a heart defect because of A, B, C, D. There are those that we do know, as she mentioned, those which have got a hereditary or a genetic component, that in a family who have had a child with heart disease of this type, there is a high likelihood that a mother or another generation sister might present a heart disease of that type. you look at it as the genetic predisposition, that hereditary component of heart disease. But that shouldn't be misinterpreted as the other cultural norms where someone says, that family, they have heart defects. Because in our practice, we have met mothers who have been abandoned by their partners, their husbands, because the mother, because the mother had a child who had a heart defect.
Yes.
And well, you have to look at in various dimensions. There are literate levels of Uganda, they are not that high. So you will have a certain part or sector of a population which believe in some traditional tendencies, and some might interpret it that that family has got their things, which is wrong, because that defect occurring in that family is isolated, and you will find that there are other children who are normal. Then when you come from that, there are other infections which we have studied and have understood that such an infection occurring during pregnancy increases the likelihood of the mother giving birth to a child with a heart defect. So what do we encourage as prevention in this is mothers to attend the antenatal care. If there is any treatment that needs to be given, it should be given and attention provided. Now, there are other factors which are related to the individual characteristics of pregnancies. For instance, drug abuse during gestation period, during pregnancy, alcoholism during pregnancy, infections I have mentioned, that can propose a mother to have a child that they are carrying to have malformations, but also not singularly that they are explaining. They only increase the likelihood or the risk. We discourage them, and if they are occurring and identified, to be stopped or the mother to get attention. Then the others are some deficiencies during pregnancy which can actually lead a pregnancy to have malformations related to the heart or any other structure, brain or gut in a patient.
Interesting. Dr. Nordrin, allergy detection, screening, how do I tell that at this point, according to the signs that I have seen or symptoms, I could be a patient or a victim of a heart disease? Are there those that we can rely on, or what should parents, individuals look up to for or out in terms of signs and symptoms of heart-related diseases?
Okay. So I'll start with the little children. So we'll start with maybe the appearance of the child. So sometimes you'll find some little children, when a child is born, they should turn pink. And being pink means that the fingers are pink, their lips are pink, their tongue is pink, and that shows that they're getting enough oxygen in their blood. When there's not enough oxygen, sometimes they will have blueness. The lips will be a little blue, the tongue might be blue, the fingertips might be blue. So these in newborns are, luckily a lot of the births these days are happening in hospital, and these are picked up quickly, and these children are sent to us quickly. But also there are those who will leave hospital and seem fine, but you notice the child is breathing faster than normal. Okay, you'll also notice sometimes that the child finds it difficult to breathe. The baby should be able to latch on the breast and feed for a significant amount of time until they are full. But with heart babies, because they need to keep breathing a little faster to compensate for the heart not squeezing so well, they struggle to breastfeed. So the child will latch onto a breast for a very short time and immediately they stop. Latch on and stop. And some mothers are able to keep this up for a couple of months, but you'll notice that the baby is not gaining weight as they should, and that's another important sign for us. Why is the child not gaining weight? So we call that being small for age or low weight for age. Then these children also, because of that, will end up being at a higher risk of infection, and usually these are respiratory infections. So you're always in hospital for cough and flu, and they keep telling you the child has pneumonia. Then that's a reason to be screened for a heart condition. Okay. Also, there's some particular conditions that, you know, the child will have particular mannerisms, like maybe they walk for a distance and then prefer to rest by squatting. That also shows us something. The children, as they grow, they will not be as active as the rest. So your child gets tired very fast while running with the rest, or finds it very difficult to run, or they play and have to keep taking breaks while they play. That will also, those are some of the things that we see. Then obviously we have the swelling of the feet, swelling of the abdomen that will be noticed. For adults, you know, we usually start with just your vital signs. We like to talk about that. And your vital signs involve your heart rate, which is how fast your heart is beating, your blood pressure, a higher blood pressure or a very low blood pressure, okay, will also tell us something. And then your oxygen content. And then with time, they also get these symptoms. An adult, maybe you know that if you're someone who has a farm or in the village, you have your garden. You used to dig constantly from 5 a.m. to 10. Now you dig from 5 to 6, you need to take a break. Then again, you dig from 7 to 8, you need to take a break. So you find that your level of activity, tolerance to activity, it goes down. That is a sign that needs to be looked into. Swelling of the feet and things like that are also signs that need to be looked into. And sometimes also you'll end up with things like frequent respiratory tract infections again. So that's frequent coughs, flus, pneumonias, and the like. So I think those are quick, easy things that should take us to hospital to be tested further.
Our dear viewer, the pictures that you see on our screens are some of the facilities that we have in the country, and Dr. Nodrin is going to tell us later if we have a very effective and equipped facilities in this country that at least will give us assurance that we're in the safe hands. But before we come into our department of the equipments and the facilities in the country, I would love to come to you, Dr. Hosi. If we have enough heart surgeons in this country who are trained not just here in Kampala but across the country.
Well, thank you, Amon. The Uganda Heart Institute, for the facilities which we have, and as per the theaters, the ICU beds, we have enough surgeons in the Uganda Heart Institute. But we don't have enough heart surgeons for the 50 million population. For the hospital where we are working, we have got two teams, a team which operates adults and a team which operates children. And these two teams are headed by our senior mentors. One of them who has mentored us, Dr. Tom Mwambu, who is the head of adult cardiac surgery, and Dr. Michael Kecho, the head of pediatric heart surgery, where I belong, my head of department. These two mentors have ensured that they grow their respective teams. There are training programs in which we are training heart surgeons in Uganda, for Ugandans and working in Uganda. As per now, we have graduated 3 fellows who finished their training and are now in service working with us. And we have training programs at the Heart Institute, not only for surgeons, but for anesthesiologists, the department of Dr. Nodrin, for critical care specialists, for cardiac nurses, for cardiologists, both for children and for adults. And each year we take in qualifying entrants candidates who have satisfied their prerequisites as a master's in internal medicine for cardiology, masters of surgery for cardiac surgery, masters of anesthesia for cardiac anesthesia, and a Bachelor of Nursing for nurses entering the program of cardiovascular nursing. These trainings are growing. Maybe to inform the viewers, the Heart Institute is currently building a 250-bed hospital supported by the government of Uganda in Naguru, a hospital which is expected to be operational as early as 2027. So currently we are, Dr. Nodrin, we mentioned of her space in the ICU at the Heart Institute, but the new hospital at full capacity, it will certainly increase the human resource needs by almost 5 times to the current staffing needs we have at the current Heart Institute in Murago. So that means that our training programs are active and have got to make sure they churn out enough candidates, surgeons, anesthesiologists by 2027 who will be working in the new hospital. But also you have heard that we do operate children at regional referral hospitals, and as the country grows, most of the districts where there are regional referral hospitals were elevated to city statuses. Jinja City, Mbarara City, Hoima City, and Guru City. And all these cities, by their design, they have got to have specialized hospitals. As we can inform you that in the National Development Plan 4, which is in effect this financial year to the financial year 2031, there is a plan of actually establishing regional heart centers, in that a patient who is born in Guru and requires diagnosis and requires surgery can have their surgery at a regional center in Guru. A patient from the southwestern region can have their diagnosis, intervention and surgery at Mbarara. The same thing in the eastern Jinja and in the further western Hoima. And these places will need specialists, and these specialists are being trained here locally.
Okay, that is a very good initiative and effort put in there. I was wondering if we're going to keep establishing those centers and then we don't have people to operate them. But that is a very good initiative and effort that we have as a country. I come to you, Dr. Nutrin. It is one thing to have surgeons and experts in the country, but when they do not have facilities to use, how can you assure the people of Uganda that we have enough facilities and equipment to work on the people of Uganda, especially those that will have heart-related diseases or issues?
Okay, thank you very much, Amon, for that question. But before I get to it, I'd just like to add to something that Dr. Muhoozi said when he was talking about training. Training a specialist in a cardiac, the word cardiac means heart, so we'll keep using cardiac. So training a heart specialist in any field, whether it is cardiology or cardiac anesthesia, cardiac critical care, cardiac surgery, is a very lengthy and expensive process. And I just want to state that for this reason, the numbers take a while to build up, because let's take the example of an anesthesiologist, a cardiac anesthesiologist. So you have to have someone who's completed their medical degree, completed their medical internship, then in some institutions in Uganda, they have to work for some time before they enroll for a master's in cardiac anesthesia. So cardiac anesthesia and critical care. So when they're done with that master's, then they come and do a fellowship training, which is an additional sort of super specialization in anesthesiology and critical care.
You're engaging into prayers that most
prayers,
of us think.
we cannot say no to prayers. but this is a different type of fellowship. Yes, so it's a super specialized training after a master's degree in the medical arena. So that is sort of the trajectory or the path that even the surgeons follow and the cardiologists follow. So thankfully in Uganda now, the Ministries of Education and the Ministry of Health have accredited training programs to sort of help boost especially the numbers of the specialists. So for the surgeons, they have the College of Surgeons of East Central and Southern Africa that's building onto the surgeons being trained by the universities. For the anesthesiologists, the Association of Anesthesiologists of Uganda has also brought on board the College of Anesthesiologists of East Central and Southern African training program to sort of help boost the numbers of those specialists. Then those specialists will have to come into, the Heart Institute to train in cardiac. And this happens with nursing as well. So it takes a while to build those numbers. And yes, we have a new facility that's opening, but we need people to get interest in cardiac and then come and train to join us and build the teams, because we need the numbers. So I will now come to your question. Do we have the equipment? Setting up a heart service in a country is not something that you can gamble with. Internationally, there are standards that are required or recommended, or the standards that have to be met before your facility can be accepted as a facility that is safe enough to provide these services. Thankfully for us in Uganda, through the support of our government and other partners, but mainly our government, we've been able to set up a state-of-the-art facility. So whatever service that you're getting here, it is very similar to what you will see being done in India, in the US, and sometimes you'll see us talking about medical camps that we are doing with people, expatriates. You do not, we cannot compromise when it comes to a heart condition. The heart needs what it needs in order for it to be operated on successfully. So even when those teams come, which has really reduced because we have capacity now, but when they come, they are using the same equipment that they are using in a first world country. So do we have the equipment? Yes. Do we need more equipment? Yes. And we are hoping that at least the next step will be when we have the 250-bed hospital set up. We are ramping up our ICU or critical care number of beds will be multiplied by about six times what we have now. So we expect that our capacity is going to grow by that much. We expect that our surgical capacity is also going to multiply exponentially. But yes, we do have the equipment, but we need the people to work on this equipment. Yes, thank you.
Interesting. In every situation, especially in Africa, we tend to mix issues, especially when it comes to misconception, culture, and so very many things. I am wondering from your end, as experts, especially the surgeons, Dr. Mhoza, I come to you, what are some of the misconceptions that people of Uganda and Africa tend to attach to heart-related diseases?
The misconceptions were, the first one is what I mentioned, where a mother gives birth to a child with a heart disease and is abandoned by the husband or the family. Some of them isolate her and claim that maybe there has been bad omen. That's a misconception. And then there is a misconception in regards to recovery. And this is not only in Africa. We have trained, through our training and practice, we have studied in different other places, and surprisingly, some of these misconceptions transcend the boundaries, and you find there are people who used to actually believe that a heart cannot be worked on, that if you touch a heart, that's the end of the individual. There are things which need to be understood. At times we carry out surgeries and the recovery process might not be excellent as expected in a few number of patients, and you find that you have to support this heart with a pacemaker, support its activity. To one who is not given appropriate information, they might think, this one, they touched their heart, they shouldn't have, that's why it's no longer beating normally. And then the other misconceptions, the confidence, the practice of heart surgery, yourself, in the, let's say, 10, 15 years ago, when a patient would need open heart surgery, you used to see in the press, on TVs, mothers soliciting for help, money to go to India for surgery abroad. So we have had to build the confidence in our patient population that these services are offered here and offered safely. We have had scenarios where you actually book a patient for theater, for surgery, and the patient said, no, are you sure this can be done here? The matter of fact, I had a patient whom we booked and we consented and agreed, and the morning of the surgery, in the morning when they were supposed to be taken to theater, the mother said, my heart has refused, I don't think. And then we have had cases of even simple things which are easy to us to be worked on, and you find a family which say that us we prefer to be referred. But then referral abroad is a cost to an individual. even if it is not a cost directed to our government, it is a cost to the national economy. When you are looking at heart surgery abroad, you are looking at a tune of close to 70 million Uganda shillings, and a service which is offered here in Uganda to a fraction of that. So it means that that 70 million is coming out of our system, our economy, to support the patient abroad. And that's something we are working on, and even on increasing capacity with the new hospital, which we hope to have by 2027, is to make sure that we reduce on that hemorrhage of money that is paid to a foreign system for the healthcare of a Ugandan, the healthcare which should be solutioned here. So there is that misconception of lack of confidence in our own system, but that is growing and is improving as more patients have been handled, and we have got a number of recovery successful stories from our patient population.
Yeah.
Interesting. If we can use the few minutes that we are remaining with to talk directly to the people of Uganda. Do you have any challenges that you have encountered, Dr. Nordondrin, that we, the sympathizers, we, the stakeholders, we, the intending to be partners, can maybe help in and be part of this game-changing cause?
Yes. Thank you very much for that question, and thank you for the opportunity to talk about this. As Dr. Muhoozi has said, I think one of the still pitfalls is that we still have a number of people that don't believe we are doing heart surgery in Uganda. So I think one of the things we want to start with is by assuring the public that yes, we are able to handle some congenital heart conditions in Uganda. Okay, and we're doing this daily. So just have confidence in your country, have confidence in your team, and where certain things are beyond capacity, and we're always very open about that. I think going forward, our focus is mainly on training. We need the numbers, because as Dr. Muhoozi said, we are working only at the Heart Institute, and that is only in Kampala. We have the rest of Uganda that we need to start working in. So right now our focus is on building capacity, and that's in terms of infrastructure and human resource, and that is where we need the bulk of the input. Yes.
Interesting. Parting shots maybe, but before I come into parting shots, I will come to you, Dr. Muhoozi. You talk to the people of Uganda, building their systems, trusting their country, trusting their own children that we can do this, but also talk to the parents, teachers who have patients, and how best should they manage them, especially post-surgery.
Thank you. The management of patients post-surgery, once we have operated a patient and the surgery was successful, all our patients pass through critical care services. That's an ICU. Each heart surgery patient passes through an ICU where they are stabilized to ensure that the surgery which was done, the patient is able to recover properly. And this occurs in a manner that the patient's care is downgraded from the severity to the point when they can go back to the general ward. And a patient doesn't leave ICU to the general ward until we are comfortable and sure they are stable for that standard of care. Now, our patient to be discharged from the hospital is discharged with a clean bill of health as per the surgery which was done, that the patient is fit to go back to their home, to go back to their community. And we design for them a follow-up mechanism of when they should come back for review. It can be within the same month, it can be after a while. And as I mentioned that there are things which we are doing at regional referral hospitals. There are regional referral hospitals which have got a cardiologist, like Mbarara Regional Referral Hospital has got an able cardiologist who is able to look after and treat heart patients. So if we see a patient who is coming from that side, and it would be rather challenge for them to come back for review with us, they can be reviewed there. The same thing with ginger. And if there is anything which we feel that we need to attend to, for instance, a patient who after surgery had a rhythm that was not adequate and we need to follow them up, we give them that guidance. All in all, majority of the patients who are worked on, they recover well. There are those who will have some small complication. The complication as simple as a wound infection, a wound getting infected after surgery. If it doesn't require them to stay in the hospital, they can go home and they be seen or reviewed at a later stage. And then the other thing is in the community, there are systems now where a patient can actually call on specialists for guidance or even to book that can I come on this day, or if this we know that there was a certain complication which we think that can actually be attended to by a normal doctor at a regional hospital, a district hospital, we also guide them as per what is needed to be done.
Interesting. What do you see in this profession, in this career, this whole exercise in the next 10 years, Dr. Nordrin? Any new technologies, any new innovations, where do you see this, especially in Uganda, for the next 10 or 20 years to come?
Yes. For the next 10 to 20 years.
So what are your prayers?
Well, I will say what I said. I was asked a similar question earlier today, and our vision, again, or my vision, my prayer, is for equitable access to healthcare for all Ugandans, for every Ugandan, irrespective of where you're from, your socioeconomic status, you should be able to access the highest level of health care. Okay? When we bring that down to cardiac, I think the future is bright. The first thing is we have the will. We have the will to do this, and we have the will to grow this. And I'm happy and proud to be part of a team that is keen on seeing this growth, that is being very proactive about growth, and that is going out of their way and even getting creative with our setting to deliver the state-of-the-art care that every Ugandan deserves. Every Ugandan deserves high quality, decent health care. We all deserve that. And that is what we're working towards. In the next 10 to 20 years, we hope that much as we have state-of-the-art or world-class equipment, we are still missing a lot of it. And so our scope is limited to an extent because of some specialized equipment as well as expertise. But we hope that in the next 10 to 20 years, we will have that. And we call upon all Ugandans who are interested in joining the medical fraternity, come and join us, come and work with us. Yes, it's a long road to get to this point, but we are here to serve our people. We're on this earth to serve. So let us get the boldness to come and do this. But yes, the future is bright.
That is interesting and also encouraging. As we come to the end of our conversation tonight, I would request my guests to give the parting shots, but also a take-home. Dr. Mhozi, what should be a take-home for all of us and the viewer on the other side?
The take-home message is disease prevention, prevention of heart disease. It will save an individual a lot of expense, and it will guarantee that they have a normal beating heart. Now, prevention, when you come to heart defects, we encourage our mothers to attend their antenatal care. Those who don't have access to at least be in touch with their midwives for the guidance as which supplements they can take, if they lack folic acid, if they need iron, what do they need. Then if they identify that there are some infections, to get them adequately treated. And then if it is discovered that the mother is presenting with gestational hypertension, high blood pressure during pregnancy, to have it well attended. A mother whose blood sugars are elevated, to get them attended and seek professional care. Then the others are to minimize the other risk factors that we discussed. Avoid alcoholism during pregnancy, avoid drug abuse during pregnancy, and to at least make sure that during the course of this pregnancy, routinely get checked. Then when it comes to the adult, incorporating exercise as a routine to your daily life will reduce the risk of heart disease. Eating healthy. At times, doctors, we are not the best to guide on diets. I don't know, Amon, what is available to you in your home, so I can't come here and pretend and say, you go and eat salmon. Do you have access to salmon? But I would advise you, eat healthy. Incorporate in your diet fruits, vegetables, reduce the consumption of sugar-based foods, carbohydrates. If you are eating meat, I'm not stopping you. There's a doctor who once went and told an old man that, no, you stop eating meat. Meat is affecting. And the old man said, it's what I've been eating. What do you want me to do? Do you want me to die? So if you are eating meat, you can have it in a healthy way. Instead of frying it, you can boil, you can roast it. And then balance your diet. Watch your weight. At the Heart Institute, we usually say, know your numbers. Know your numbers is to know your blood pressure, know your heart rate, know your weight, have your BMI controlled so that you are a healthy individual. At the end of the day, you are saving yourself an expense and you are saving the economy an expense which can actually go to other things, education, and improving the general welfare of Ugandans. Those are my parting shots.
And also saving lives.
Absolutely.
What would be your parting shots, Dr. Dodri?
I will continue my parting shots from where Dr. Muhoozi stopped. If prevention has failed and you find out that you have a heart disease, seek the right care from the right facilities. I will emphasize that from the right facilities. Yes, currently, as we said earlier, the Uganda Heart Institute is the only center currently providing super specialized cardiac services. We have a variety of cardiologists, both for children and for adults, and we have all other specialists that are related to heart disease, the continuum of heart disease. So if, unfortunately, the prevention has failed, or unfortunately you find out you have a heart disease, or your child has a heart disease, then seek care from the right place. You're always welcome to come to the Heart Institute. We have outpatient clinics running from Monday to Friday. So come and seek care. And once the healthcare providers put you on medication, then stick with your medication. If surgery is recommended, sometimes people say, oh, let's wait. And unfortunately, many times by the time they come back, sometimes it's too late for us to operate on them even. So just follow through with what your doctor says, and it will get better. And again, heart disease is treatable. In case you end up with a heart condition, many times it's treatable. And if it's not treatable, then you can be managed to live a quality life, whatever that means for what condition you have. Thank you.
You've heard from the experts, and I do not have to put any word to dilute what they have taught and also advised. And that brings us to the end of tonight's edition, and I want to believe that you've been able to learn a lot, especially on preventive measures. It is very important that you prevent that heart issue or problem to be able to save your life, to save this country, but also to save your money. And the state of affairs, we always bring through guests of this type to make sure that we be inspired, but also we learn a lot from them. I want to thank you, Dr. Muhoozi Kata Rwakarieva, who is the consultant and also a cardiac surgeon. I've learned that cardiac also means heart surgeon. So thank you for making time to come through on U24 tonight. And I want to thank you also, Dr. Ayopo Anodrin, who is the head of cardiac anesthesia, especially coming from Uganda Heart Institute. Thank you for making time to come and speak to the people of Uganda. From me and the team, it's a good night until next Thursday, same time, same station.